Hi, everyone. Welcome to our Cecilia Health Long-Term Maintenance and Emotional Barriers of Chronic Kidney Disease webinar. I'm Emily. I'm one of the dietitians and diabetes educators here with Cecilia Health, and I'm happy to introduce our topic here tonight. If anyone is having any type of technical difficulties, please reach out to the number below, which is 800-263-6317. And we'll see here tonight that our format includes a short presentation followed by some time for discussion. There will be a Q&A time at the end. And if you would like to ask a question, you'll see here on your webinar toolbar on the right, there is a questions tab with that, and you can just enter in your question there, and myself or Wing, our instructor tonight, will be able to answer those questions with that. And we look forward to having an interactive webinar. Now, just as a disclaimer, we know that the information you are about to hear may motivate you to make some lifestyle changes, but before doing that, please do consult with your physician before making any changes to your current routine. And the Cecilia Health registered dietitian will provide strategies to help you manage your CKD. This online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health registered dietitian. So here tonight, like I said, our webinar leader is Wing Lee. Wing Lee. Hi, Wing. She is a registered dietitian and a kidney health coach. She has experience working with patients who have CKD, cardiovascular disease, hypertension, weight issue, and diabetes for over 15 years. She lives in Southern California with her family, and she enjoys baking with her daughter, reading, hiking, and traveling with her family. So thank you so much, Wing, for tonight, and I'll go ahead and hand it off to you. Thank you.
Thank you so much, Emily. Really appreciate that. Hi, good evening, everyone. And so nice to be here with you all. Today is going to be covering two main topics. One is long-term maintenance of chronic kidney disease. The other one is the emotional barriers. Now, with the long-term maintenance, we all know that it's very important to control our blood pressure and our blood sugars. We'll be talking a little bit more about that. Also, with smoking cessation, weight management as well, which is something that is very important for the maintenance of the kidney. Now, with the preparing for dialysis, we're going to be just touch on that for a little bit because that is usually for end-stage kidney disease. So that part might not be applicable to you, but it's also information for some people that may be having end-stage kidney disease. Now, regarding about emotional barriers, we will be having tips for managing mental health, how to recognize anxiety and depression, stress reduction tips, sexual function. We'll be also talking about finding supports. Now, we know that the kidney is really, really important. I just want to briefly touch on what are the functions of the kidney really quick, because when we look at the kidneys, we know that it's filtering waste product out of our body, but it also removes some of the drugs that's from the body. That's why it's so important to maintain a healthy kidney. It also balances the body's fluids. It releases hormone that regulate your blood pressure. Also, it produces an active form of vitamin D, believe it or not, and which is it's promoting strong, healthy bones, and also control the production of red blood cell. And so it's really important to maintain our kidneys, stabilize our kidneys functions. Now, what can be helpful to maintain our kidney functions? Of course, with the blood pressure, with the blood sugars, we want to be able to maintain these things. And the reason is because for blood pressure and blood glucose, it can help to minimize the damage to the arteries and kidneys. Also, quitting smoking can improve the health of the lungs and definitely with the kidney as well. Actually, smoking is really affecting all of the organs in our body. And so it would be important to manage that, to not smoke. Also, maintaining a healthy weight can help reduce the risk of diabetes and hypertension, which is essential to maintain healthy kidney functions. Last would be dialysis, which is, like I mentioned before, it was for the end-stage kidney disease. And that means also that the kidneys is no longer able to take care of the body's needs. Now, for high blood pressure is when the force of blood against the artery walls, which increases enough to cause damage. That's why it's important to control the blood pressure. It's also the second most common cause of the kidney disease. For high blood pressure, we mainly want to maintain it by lifestyle changes. You probably have over time heard about that. We're talking about high fiber food and trying to reduce salt intake and exercising more, and because these things can help with high blood pressure. And sometimes medication may be needed. I think a lot of the people may be needing medications to control our blood pressure because at a certain age, or it could be also running in the families that sometimes we may be having high blood pressure when we're younger as well. And so, but all of these lifestyle changes and medications together would be helpful to maintain good blood pressure. Now with diabetes, people with diabetes and kidney disease, usually they need to see their diabetes educator at least once a year for monitoring, educations, and support purposes. And the reason is that when our blood sugar is too high, it can cause damage to the blood vessels, which is the kidneys that contains a lot of this very, very small blood vessels. And so that's why control the blood sugar is really important as part of the maintenance. Ongoing checkups and follow-ups are also important to prevent disease progression and also helps to detect early signs of disease complication. Now, smoking cessation, of course, it's not only bad for the lungs, but it's also bad for the kidneys. And like I've said before, it can affect every organ of the body. People who smoke are more likely to have protein in the urine, and that is also a sign that your kidneys are under stress if there's a protein that is identified in the urine. Now, if you happen to be smoking, I know I have some of the members too that they would really want to quit smoking. There's different options out there. Some of my members, they might want to prefer asking the doctors regarding about certain programs or maybe medication. I think this is one thing that's very tough for people who have been smoking for years, because it can be helping them to calm them when they're anxious, if they have anxiety issues and they want to have that smoking that's helped them to calm them down. Or they might be smoking when they're much younger, they develop that habit. So, but it's always good to set out goals, realistic goals that help you to stop smoking. If you can choose a date to stop, it doesn't mean that you stop on that day, but you want to choose a day so that, okay, I'm going to start doing this now, and I want to make change. You can also change your environment a little bit to shift it into some kind of nicer environment. It could be you can put some plants that's nearby, something that can change it a little bit so it won't be like that you will have to smoke around the same spot, and something that can be changed would be better. And also let others know that you're quitting so they can be support and encouraging you for this change. Also, again, you can talk with the doctor or ask about medication. Be prepared to fight urges. It usually take about 3 to 5 minutes to stop the urge for some people. I know everyone is different, but if you can think about something that you can do immediately if you have the urge, let's say, okay, I'm going to go out for a walk for 5 minutes, or okay, I'm going to go to the bathroom to take some deep breathing. Use the belly breathing, like the deep breathing. Practice that for 2 minutes, 3 minutes, or maybe drink a tall glass of water, or do something that to distract yourself, so you can start to fight that urge. Because a lot of the times, it's a tough thing when you have that overcome you and say, oh man, I failed this time again. But if we're to do something to stop that urge right there, there's chance and to fight it off. And then I also learned this as well. It's very interesting. I remember one of the social worker talked about how to stop smoking, and she mentioned something about like calculating a whole year, how many cigarettes that you're buying, and calculate how much you're spending on cigarettes, and you'll be surprised that, oh, I spend this much on cigarettes, and you'll be like, oh no, this is so much money. And then some people would give him some feedback that I would just rather spending these on other things that's really good for them. So that's also one thing I find it interesting. Also, avoid something that's when this urge to smoke, try to find something to calm yourself, if it's just chewing gums or something, but avoid excitements and things that would trigger anxiety, because that would be making it worse. Or maybe just go and eat a healthy snack, eat an apple, or chewing on some carrot steak with yogurt or something like that. But last, you can identify resources that can help you with smoking cessation. Now, with weight management, excess weight can increase the risk of diabetes and hypertension, which is the two major causes of chronic kidney disease. With this weight management, I know that people would like to want to start maybe a diet or exercise program. You can definitely check with your healthcare provider. But there are some tips to get you started if you would like to work on weight management, because it definitely would be helpful for blood pressure and blood sugar management. You can keep a log for food and exercise log to kind of keep track. I know some people are really good at Excel spreadsheet, or maybe there's also apps as well. It's very popular now that people are using app to log the food intake and exercise. I have one member, he does that. It was a long while ago, and he was very good back in the time, because he found out that he was going to have diabetes, and so he started reading a book, log out of his food. It was not easy though, but he make it happen. It was during COVID time, and it was he doesn't really have to go out a lot, which is, it's also an advantage to him, because it wasn't that a lot of going out dinners or times that he has to deal with. So he did this, log off the things on his app, um, make sure that he's eating this and that. He ended up lost a lot of weight, but it's not an easy thing to do because we're dealing with going out with friends and family for dinner, for lunch, um, and we're talking about choosing healthy options when we go out, and also um, at home. I have another member who's telling me that it was really tough for her because her husband's also bring home with some snack that are not so good. And when he was away for a business trip or something, she find it much more relaxed because she could choose the healthier options now and she has the control. So I think it's really tough. Everyone has their own thing and challenge to work on. Um, but we have to find out certain ways so we can work it out um, to achieve this. Now, some simple things that we can do is to look at high calorie food and you can enjoy and try to switch it to a lower calorie options. Also plan for hunger. I think this one is pretty good. Is that we have hunger time. So in between meals, maybe we can think about uh, grab a yogurt with some carrot stick, like I've said, or some kind of fruit that you really like. I know apples is, I love apples all the time. Like once a day, I eat the apple because it's just very sweet and crispy. And find the one that you really enjoy during those times. But I also noticed that I have some of the members telling me that they're trying to avoid late night snack, particularly for those people that um, want to sleep late. And so during those time, they're trying to sleep earlier, or they also trying to brush their teeth earlier, um, so that they won't experience those hunger time at night. It's not easy to do because again, everyone has their own sleeping pattern. Um, but I have another member that's she has her TV in her bedroom. She just watch TV during the nighttime, although she sleep late, but she's not cruising around in the kitchen. That's her way. She said, it's been working for me so far. Yay. That's great. So whatever that worked out for you, and it would be great to write them down um, of what are your challenges and just think outside the box and see what is really that can be workable for you. Another thing we can do is to slow down, eat more slowly, because we tend to get more full feeling within the first 20 minutes. So when we eat slow, trying to chew our food, enjoy our food, we will tend to eat much less. But it's also a hard thing because I have a member say I have been eating all my life like fast. But yes, I understand that. But maybe just a little bit by little bit, we're trying to be more aware of our eating patterns and things that we can start working on and eventually can become our habits. Of course, exercise plan as well. And I think that's a very important one besides the diet, because with the exercise, it's helping with our blood circulations. It's certainly training our muscles. And so that would be help with the weight management. I just have a member, she, um, it was very interesting because she felt very sad because she thought that she's getting back all the way again, and something happened, and then she said, "Wing, I need to really change." And so I asked her about the exercising part, and she said, "Well, I have some friends that also go to a gym." Um, I said, "That's great." So she just signed up for the gym and classes. She make the move. She was kind of a little scared to go to the gym because she hasn't been there before. But there's always some places we need to get out of our comfort zone, and to do that, and we encourage them. Um, and that encouraged me too, because this is not something that we should do it alone, which we'll be talking about later on regarding about support. Um, if you have family members and friends that can cheer you on, those are very, very, very important. Okay. Now, this slide is about preparing for dialysis. Like I've said, it's only for people that have end stage, usually stage 5, end stage kidney disease. Some people with chronic kidney disease, yeah, with their kidneys that no longer taking care of their needs, and they would need dialysis. And usually the GFR number is less than 15, which means that you lose about 85 to 90% of your kidney function at this time. Now, dialysis remove excess waste, salt, and extra water. It also keeps a safe level of potassium, sodium, and bicarbonates in your blood, and that helps to control the blood pressure. And there's two types of dialysis. One is the peritoneal, the other one is the hemodialysis. And so dialysis can be done in the hospital. It can be also done in outpatient office or at home with the peritoneal dialysis. And usually at that time, you and a doctor will decide which place would be best for you, for your lifestyle. Dialysis will not cure kidney disease. Patients who need dialysis will continue to need it unless they get a kidney transplant. And many patients can just live normal lives while they are on dialysis. And you may also need to be on a special diet. It's usually a renal diet that if your potassium and phosphorus is high, you may have to be restricting those things, and of course with sodium as well, because it will be retaining water. So there will be a special diet that a person that have dialysis have to be on, and then at that time you'll be checking with your healthcare provider and a renal dietitian. Now, emotional barrier. So managing mental health is something that I know we have a lot to talk in these days, because, and I think it's good to be aware of stress, anxiety, and things that can be not so good for our body. Because with the kidney, it's not so easy if you also have other complications, and some of them have maybe cardiovascular disease, or if they have diabetes and different kind of complications. That also adds up more to the body and to mental health. And so there's a couple of things which is very important. First is to find someone that you can trust to talk about it. And because to maintain kidney functions, it's something that's lifelong. And if your kidney functions is stabilized, keep doing what you're doing, exercising, eating healthy. And there are some days that we might not be, well, there's days that won't be perfect. But as long as you go back to your doctor, we can have regular checkup, the kidney function is pretty stabilized, it's great. But when the kidney functions, it's maybe some members, oh, look at my number has gone down. Maybe we have to take a look at closer of what we're eating. So these things will be putting more pressure on us, and it's a real thing. So to find someone that who you can trust, whether family member or friend or even counselor or therapist, will be helping us to get through, I should say, journey with this condition. And also, excuse me, don't be too hard on yourself. And it can be really quite stressful sometimes to live with these conditions. It's a lot to manage. And I have one member, she is younger, and she really have a lot on her plate, and she want to lose weight. And at the same time, she has to take care of her son, and she need to study. And she told me she gained back the weight because it was so crazy in the last few weeks, so crazy. Because you have to have late exams and all kind of stuff just come at her at one time. So it was very, very stressful. So I told her that, okay, we need some deep breathing, right? Practice some deep breathing. And also at the same time, say, don't look at your weight right now. We don't need that for now. Just do what you can do. If you can do some simple sandwiches, chopped salad, and you can continue to check your blood pressure because it can be high at times. Remember to take your medications because that can cause your blood pressure to go high if you don't, and she forget about that. And so when we're focusing on, we have a lot on our plate, and then we're also focusing on our blood pressure now, on our weights, it's very tough. And then I asked her, have you ever talked to your family members? How about your parents, or do you have any sibling? So she said, oh, that I think I should connect with my dad. I said, that's great. She said, maybe dad can offer some helps. Awesome. Family members, it's really great support. And so, yeah, everyone, we need to look at how this thing can impact us, and also when we have small successes, that means that okay, I get through tonight without eating late night snack, and I'm gonna go enjoy tomorrow, go out. I know that right now it's springtime, it's getting more warmer, the weather. Let's go out to the lake, walk nearby, and look at the natures um, and celebrate. It doesn't have to be. Sometimes I know that it's hard to not to associate with food, but when you can, it's very interesting when you can control yourself not to eat something sugary, but rather an orange or apple. You feel happy. I have a members are telling me that she feels so much more happier after she started on reading a book about how to eat healthy, but it was a faith-based book. And I'll talk a little bit about later on. But then it's telling them what are these things bad for her? Why are these things bad for her? And they have recipes on there. And she started making this recipe. It doesn't look like too hard. And she's like, I really enjoy them. I'm like, great, awesome. And she feel happy about making those healthy choices. And so, yeah, we celebrate this small success, and one thing is to have a heart that's a gratitude heart, to give thanks for things that even small things to help us to stay on the positive side. And I think also one thing is that important is that we don't let our diseases I don't want to say diseases because it's so negative. It sounds like it's negative, but these conditions, they don't define us. They can. I mean, I can choose. I can choose to be happy over small things. I know I'm in pain right now. Maybe my joint, I have arthritis, and I have this kidney problem. I have arthritis. My back hurts, and stuff like that. And there's ups and downs, but we don't let those things define us. And so that's when, if you have families and friends or someone who you can trust, even your doctor, some of the doctors are very caring. Talk to them about it. And we just need to encourage one another. I think that's really important. Okay. Now, if there are days that you don't feel well, think about if there are days that you don't feel well, and think ahead. Oh, I don't know if, next week I'll be feeling, but I have this plan to do something that you feel happy about. If you don't feel well, um, you can maybe read a book that you enjoy, or I have a member that she likes to draw. She likes to make art pieces, put them together, or even just go out. We're having sun today. Let's go out and look at the sun. Whatever that's available for you on the day that you don't feel well, plan on doing something that makes you feel happy or joyful. I know it's hard sometimes, but if you plan ahead, it can be helpful. Take charge. So living with kidney disease or diabetes or high blood pressures, these things, doesn't mean that we should give up on our goals. We have, I have members that they are very determined. Say, I'm going to work it out to eat healthier. Uh, I don't need to have these snacks around me, and I'm gonna plan up some strategy. I have these goals that's been written down. That's great. So focus on setting some realistic goals, something that you can do, and move toward them one small step at a time. Because it's so hard to say, I'm going to lose 5 pounds this week. I mean, of course, it can be doable, but again, in reality, it's not, and it's not healthy that way. But I will say, how about if you want to look at weight? How about let's talking about for the next 1 or 2 months, maybe 2 to 3 pounds. Who knows? And so just keep your goal to be more realistic. It's important. Now, make me times. It's also important to set our boundary around the illness and not letting it to consume our thoughts, all of our thoughts and activity. I mean, it's true they will be in our thoughts because we worry, and it's the human nature to do that. But when those times come, we have to make some times in between, if we're having appointments here and there, doctor's appointment here, maybe I have to see my doctor for arthritis or for allergies or for this and that. Well, in between those times that you don't have to deal with your conditions, set out some time for yourself. I have, which I'm going to talk about later on. I have a member, she said when she is stressful, she just wants to get into her recliner and just lay there and relax, and relax. And so simple stuff that maybe can be helpful. Okay, now recognizing anxiety and depression, advanced kidney disease, which is usually probably maybe in stage 4, in stage 5. And so when you get to that one, if actually majority of the members, they're about stage 2, stage 3. I know some may be stage 4. So stage 4, stage 5, maybe more advanced kidney disease. And with depression, they share some same symptoms such as fatigue, sleep problems, poor appetite, and trouble concentrating. So it's important to discuss these symptoms with your healthcare provider to see what is actually causing these symptoms. Is it your kidney disease, or is it really you have depression or maybe other causes? And some other symptoms of depression also include difficulty doing things that you typically enjoying, feelings of guilt or shame, worthlessness, hopelessness, crying, sadness or irritability, withdrawing from families or friends, thoughts of self-harm. So these are some other symptoms. So to recognize these possible symptoms, it would be helpful if a therapist or counselor appointment would be helpful with these conditions. Okay, and also stress reduction. Yeah, we oftentimes have so much stress, not just with the kidney, but big and small. There's a lot of things that's causing a lot of stress. Some of the simple ways, and I hope that these can be helpful to reduce our stress in life that we're dealing with every day. Eat healthier food. Like I mentioned before, the members was happy that she's eating more healthier. She feel better. And the thing is that she's feeling better after eating healthier food, because when you're eating food that's high in salt and sugar, it can affect it can affect your blood pressure. It can affect your blood sugars. And so when these things are high, your body is telling you something is not right and you don't feel good about it. So your body is a very good signal. When you're feeling good, it's actually maybe you're doing something right. And so maybe we need to limit salt and caffeine and sugar and fat, excuse me, and set aside time to relax. I think that's very important. Set aside some time to relax and maybe do it more routinely as well. I have one member, I feel so sad for her because she has almost no time to check her blood pressure, and she has high blood pressure. And the reason is because she has to take care of the grandkids. And there was a lot of responsibility, and also her family members was having cancer. And so there's things like that. But if you can, as possible, routinely set out some time to relax. We really need that because we need to have those energy in our mind when stress come in. Sometimes it's very suddenly and very unexpected. But we need those times in between to keep us healthy. Now, some people maybe practice yoga, meditations, and stuff like that. Some people may pray. I have members, and so she bought this book, and it's a Christian book that she was bought that's teaching her how to eat healthy, and she was praying to God for the power in her to be able to get it done, to make that healthy choice. I'm like, that's great. And so whatever that works out for us, I hope that these can be also tips for you as well. And you may have better suggestions as well. So it's because I can tell that I was just talking to my member the other day, and I felt that we always have the voices from like from the angel and from the devil. It's like, I want you to eat that right now. You're so stressful. You can eat that and feel relaxed. But it turns out too, it will raise your blood pressure, it will raise your blood sugars. So the voices that is telling us, if you have that feeling, it's like, I know this is wrong, but I'm gonna do it anyway. Um, but you have the right moment right there. It's actually we have to do the opposite. We have to do the opposite and do it quick. Or eat something healthy instead of the junk, the milk chocolate. Or maybe we'll choose the dark chocolate versus the milk chocolate. Um, it's just because of how it can affect our state of mind sometimes, and indeed it affect how we're feeling when we're eating these foods. So okay, now again, for stress reduction, continuing here, yeah, like I mentioned, we can talk to friend, loved one, spiritual leader, maybe your pastor or pastor's wife. And oftentimes they are very good resources there to talk to obtain that um, positive encouragement from them. And also, we need to hear from someone else who care about us. That can be powerful to help us to move along. Write down your problems and think about the best solution for each of them. Um, this this might not be for everyone. Some people like to write it down. Some people just like to think about it, and then I'm gonna just do it tomorrow. Okay, great. So whatever that's work for you. I personally thinking when you write it down, it gives you more clear directions about what you're gonna do and what things that you can accomplish it. So with your clinician, you can certainly ask your clinician, your health coach, to work this out with you together. And just feel free to brainstorm stuff that I think maybe because of this that affect my stress, or I think because I've eat this um, um, burrito. Let's say, I'm sorry, just think it out loud for the food, and I don't know how to deal with it. I just go to a fast food restaurant, and how about, okay, if you don't cook and you have to go outside to get food, or you have to do microwavable, yeah, talk to your health coach. How about other alternatives that we can do, and write them down. And the more specific you can write them down, the more you can see that what's really happening in you right now, in your life right now, that you want change. Because sometimes we think about it and then we forget about it in certain specific things. So we can prioritize what things to be addressed the most that you want to be addressed. Again, set realistic goals and expectation. Get enough sleep and maintain a regular sleep schedule. This is so very important because that's, of course, that dictates our energy level throughout the day, and to be able to have that power to make change. Maintain a positive attitude and outlook. Go on a vacation. Um, Go on a vacation. This part, it can be really fun, but at the same time, when we go on vacation, we think about what we'll be eating and all that stuff, but yeah, just try your best and make choices that you enjoy, but they're more healthier on this, on when you're on the trip. But definitely, it's a stress reduction too if you can do that. Exercise regularly or increase your physical activity, even just increase your steps. Um, I think make small changes. We should celebrate those, um, and you might be surprised, and that small things can help you reduce stress as well. So, Okay, now regarding about sexual function, many people with kidney disease have questions about their sexual health, and you may notice a change in your interest in sex when you're having kidney disease. There are many things that can affect your sexuality if you have kidney disease or kidney failure, such as with the hormones, nerves, energy level, even medicine. Emotions can also affect sexual functioning. Stress, depression, nerves, fear of disability and or death, marriage problems, and much more, any other things. Kidney disease may cause physical changes that can make you feel less attractive. This can also affect sexual interest as well. So there are things that you and your healthcare team can do to deal with these changes. So don't be afraid to ask questions or get help from a healthcare professional. Regarding about pregnancy and kidney disease, because of pregnancy can make your kidney disease worse. So if you're thinking about becoming pregnant, you should be discussed about it carefully with your doctor, because pregnancy can put a lot of stress on your body, and having kidney disease or kidney failure can put you and the health of your unborn child at risk. So that's something to think about. Now, finding support. There are many online support communities and emotional support hotlines to help you. If you're quarantined or remaining isolated at home, I think this also means that when we're at the COVID time where we cannot go out, this can become a very good resources for us to get support from outside. And so the National Alliance on Mental Health hosts online communities where people exchange support and encouragement. And they recommend the following online support resources. So if you want to write them down or take a picture with your cell phone if you want to, with this group, that might be helpful for you. Now we have this 7 Cups. It's a free online text chat with a trained listener for emotional support and counseling. Also offers fee for service online therapy with a licensed mental health professional. Service and website also offered in Spanish. They have the EA, which is the Emotions Anonymous, an international fellowship of people who decide to have a better sense of emotional well-being. So EA members have in-person and online weekly meeting available in more than 30 countries with 600 active groups worldwide. So they are non-professional, but they can be a complement to the therapy. Also, Support Group Central, they offer virtual support groups on a lot of mental health conditions, free or low cost. And also their website also offers in Spanish. Supportgroups.com. So this website featuring about 200 plus online support groups. There are a few more. 18% offers a free peer-to-peer online support community for those struggling with a wide range of mental health issues. Psych Central offer online mental health resources, crisis news, and as the therapist functions in online support community. And NKF, this is National Kidney Foundation, I believe. So NKF peers, they connect patients who want to support with someone who has been there. So speak with a trained peer mentor who can share their experiences, especially if if you have dialysis, transplant, or living kidney donations. I do have members that have kidney transplant, and oftentimes they have issues, physical problems after the transplant, and so it's great to know other patients that might gone through the same process. Again, excuse me, again, this is a lifelong journey, so it will be helpful. With the NKF Cares they offer support for people affected by the kidney disease, organ donation or transplantation. Transplantation. It's designed for patients, family member, and care partners. And they'll also answer questions, listening to your concerns to help you cope with issues. Online communities and find support from others who are self-isolating. I guess this is also because of the COVID pandemic. They have established these community for people who need them. And so, yeah, basically that's the presentations, and I really appreciate for being here. If you have any question, you can use the question tab on your toolbar and then put the question in, and I would like to discuss the answer with you if you have them.
Well, while we wait to see if there's any questions that pop up, I do want to remind everyone, Wing, if you'll go to the next slide, we do have some webinars that are coming up. If anyone's interested, please do reach out to your health coach, and they can kind of talk to you more about dates and times of these. But here in May, we have actually one of our diabetes educators will be talking about diabetes and chronic kidney disease. And here in June is a really great overview of management of CKD as a whole with that. And if anyone has any other questions about this webinar or anything you heard today or future webinars, please do ask your Cecilia Health Coach about those questions as well. We are also on Facebook as well with that, as well as our Cecilia Health website as well. But I just want to thank everyone. Thank you, Wing, so much for covering so many really important topics and just giving us a lot of good information about that. But I just want to thank everyone again for participating tonight and joining us, and have a great rest of your day. Thank you. Take care. Bye-bye.